Hello, everybody. Thank you so much for being part of our presentation about childhood obesity in Mississippi. Today's speakers are Cecily Cook, myself, Junelyn Floyd, Margaret Guinnip, and Stephanie Marshall. So what is obesity? So CDC defines obesity as having a BMI over 30. It is due to the combination of inactivity and overconsumption of energy-dense food, which then exacerbates fragile genetics, promoting excess adipose storage. The prevalence of obesity in the United States has increased 166% since 1990. Within its 50 states, Mississippi lags behind national averages and is ranked the least healthy state. That being 39.5% of adults are obese and 24.5% of their children are obese. What is driving this issue is the history of slavery, segregation, and lasting inequities present in the state. Among those that are obese, 46.1% of adults and 22.2% of children are of Black community. Therefore, this is a public health priority. One being it is most vulnerable to children who lack autonomy. Two, the high costs associated with treating obesity. And three, the risk of developing other comorbidities down the road. Therefore, addressing this issue in various levels of determinants of health is necessary in treating this growing issue in Mississippi.
As Junelyn alluded to, poor health is not simply a result of genetics and unhealthy behavior. As illustrated in the socio-ecological framework, Mississippi's history shapes today's policies, which result in underfunded schools, poor infrastructure, low income, and food deserts. These mix with culture, learned behavior, and biology to produce the state's high childhood obesity prevalence. Mississippi's statehood has a unique political history, which has been carefully crafted in a way to maintain power among the white population after the Civil War. This has resulted in many gubernatorial functions that exist in other states being given to freestanding commissions, and these also have important implications for public policies. As a result, even today, the governor does not have direct control over the state's Department of Health or Department of Insurance. These dynamics intersect to result in key environmental and economic influences on childhood obesity in the state. In Mississippi, the most pronounced environmental health determinants are food deserts, low quality schools, and a lack of safe recreational spaces. 70% of food stamp eligible families are at least 30 miles away from an affordable grocery store, and Mississippi has strict SNAP policies that require in-person interviews when most other states simply require a phone call. This results in lower enrollment in the program. Low quality school environments is another significant factor in Mississippi's childhood obesity risk, and the pervasiveness of junk food in schools and students' preference for it poses significant barriers to encouraging healthy food consumption. There's also a lack of physical education promotion in schools. Also, a lack of school nurses contributes to the issue of childhood obesity as well. Schools in Mississippi have a lower than average nurse to student ratio, and 12 school districts do not have any nurses at all. Furthermore, there is a significant lack of access to safe recreational spaces. 52% of Mississippi residents felt high concern for their daily safety, and 46% indicate they worry most about being robbed on the street, which is 8 points higher than the national average. This high rate of perceived danger by residents causes individuals, especially children, to be less comfortable engaging in outside activities. Overall, the political and cultural history of Mississippi results in state structures that marginalize communities of color with significant implications on their health, especially for children who are generally more vulnerable to their age and dependency on others. Next slide.
At an individual level, the biological processes that lead to obesity are driven by the amount of calories consumed and energy used through physical activity. Structural determinants and community behaviors directly impact Mississippi's youth access to highly processed and energy-dense foods. For example, 588 grams of broccoli contains the same amount of calories as 72 grams of a blueberry muffin. This is nearly a tenfold difference in caloric density. Increased energy consumption combined with lack of physical activity is a recipe for excess body weight. Failure of government policies and community support prevent proper childhood physical activity. Increased sedentary behavior reduces the amount of energy used. In short, this is a double hit to tip the scale of weight balance in favor of fat storage. Further, the human body has evolved to efficiently store energy stores for times of famine. Government policies and community behavior exacerbate the impacts of industrialized food production and present-day sedentary lifestyles effect on excess body weight storage. Next slide.
Priorities for intervention should focus on increasing health-promoting behaviors through education and improving school quality and policies. Research found that barriers to physical activity in Mississippi students were most heavily influenced by the lack of knowledge and a low health literacy level, which are both significantly associated with increased body mass index, being overweight, and being obese. The Mississippi Department of Education acknowledges the impact of physical activity on bettering academic performance and student health. It endorses the Move to Learn program as well as the Fuel to Play 60 program as ways to reduce sedentary behavior in students. These programs have shown improved academic performance, increased aerobic capacity, and improved BMI in students. Most importantly, they have taught students the importance of exercise and how to move their body to promote healthy behaviors. Recommended interventions to improve school quality and policies should focus on increasing nursing staff in schools and implementing healthy school programs. Having adequate nursing staff reduces the risk of chronic conditions such as obesity because of the leadership of the nursing staff to advocate for students and facilitate healthy school programs. Implementation of a healthy school program includes installing playgrounds and safe green areas, incorporating healthy meal options in cafeterias, and involving nutrition education in the school curricula. For example, in Maryland, the Annapolis Valley Healthy School Program decreased obesity rates among students and increased healthy food consumption in participating schools compared to those not participating in this program. Thus, similar components of this program could be beneficial to implement in Mississippi schools, which could then be reinforced and sustained by school nurses. We recommend that interventions focus on obesity prevention. In order to be effective, programming should be both age and culturally appropriate. Additionally, interventions that engage the community and require community buy-in have proven to be most effective in reducing childhood obesity rates in communities. Next slide.
Therefore, as you can see, curtailing childhood obesity is an urgent public health issue. Some key points to take away from our slides is that 1, schools is where children spend most of their time and absorb information, so interventions here is most important in order to gain most actionable promise to reducing childhood obesity in Mississippi. 2, more funding and attention needs to be allocated in eradicating childhood obesity in Mississippi. Currently, average public spending per Mississippian student is about $30,000 less than the national average. Obesity is multifactorial. Biology and genetics play an important role in childhood obesity, but social, economic, and political context is where youth grow and learn may have more profound effect on obesity and related health outcomes. In order to produce healthy communities, political structures must be inclusive and elected officials must lift everyone in their communities by establishing policies and regulations that produce health and equity for those most marginalized, specifically the Black community in Mississippi. Therefore, if implemented deliberately and swiftly, while accounting for important cultural considerations, these changes could thus far have profound impacts on the health of children and communities of color in Mississippi. Thank you so much, and we look forward to your questions.